Appointments. Note from your admission on August 14th, 24. Consults filed by Matthew Bean, due at September 7th, 2024, 12:49 p.m. Psychiatry consult received for med recommendations related to hyponatremia, depression, and ADHD. Circumstances of admission reveal patient is a 39-year-old gentleman with a history of autism, hypertension, GERD, Tourette's, and asthma who presented to the emergency room from the local homeless shelter because of nausea, vomiting, and diarrhea. Patient's symptoms have been ongoing for the previous few days. Patient suspected of suffering from viral gastroenteritis. At the time of ER assessment, patient was requesting assistance and spoke with case management, who felt that patient needed to be admitted and evaluated for competency and possible placement. He did have neuropsych evaluation during this admission. The outcome of the neuropsych eval was an individual who has the ability to communicate a wealth of information, but is not able to integrate or organize this information to make an informed decision. Based on his presentation, the neuropsych service did not find that he possessed the ability to make medical decisions. He denies depression. He notes Effexor as helpful for his attention. He believes it was of benefit to combat distraction. He took Stratter in the past, but this caused chest pain. He notes Wellbutrin caused increased anxiety. He has a history of treatment with guanfacine, but notes it is ineffective below a dose of 2 milligrams. He notes Busper made him more anxious. Social HX. Patient indicated that he is from Buffalo and has lived in a group home during his early childhood and then with his father, who has been his caregiver. He was diagnosed with autism at a very early age and required 24-hour care and supervision throughout much of his life, per his report. He identifies being incontinent of bowel and bladder and having ongoing difficulty managing these because of his sensory challenges. He indicates that while in school he had an IUP but did not graduate. He has been on disability throughout his life. He identifies that his father manages his finances. He reports that he is a mother who is currently in a skilled nursing facility. He has a brother who is also on the autism spectrum but higher functioning that lives with his father. He also has 2 other half-brothers. He did find Benadryl helpful for a calming effect, which assisted with attention. Summary. Titrate guanfacine to his usual dose of 2 milligrams daily. He notes this was beneficial and he tolerated it well. We reviewed the PRN availability of Benadryl as he found it helpful for anxiety, which in turn apparently helped him focus. He understands this is available and may help replace the Effexor to some extent. He will need ongoing behavioral health care. He is very interested in following up with a psychiatrist once he is discharged from the hospital. Continue with medical care. Continue effort toward evaluating placement and support services. He does feel he needs a structured setting, as well as a trusted individual to function at times on his behalf. Adult Protective Services has reportedly been involved and had deemed him to not be able to function. And as far as capacity, as there have been issues with abuse and exploitation in the past. Thus, the recommendation for a legal guardian that has oversight to ensure that this patient's needs and best interests are protected. He did identify an individual, Daryl McElevanin 484-501-9456, as someone who has been involved in his care and seems to have a sincere interest in his well-being. Patient does agree with the plan outlined above, and we did review risks, benefits, and alternatives. He denied additional questions or concerns. This was completed remotely by way of two-way secure telecommunication with full patient consent, chart review, and communication with staff. Approximately 70 minutes was spent on this case, with half the time in counseling and coordination of care.